Hi everyone. Well, I thought to myself, what will we talk about the sphenoid bone? Well, something kind of is left behind. Let's talk about the lateral pterygoid muscle and TMD. Now, of course, we're going to be talking about TMD later, and also then we're doing the masseter muscle, which is the other muscle of mastication. But I thought, the lateral pterygoid muscle, and we'll use it LPM, because everybody loves an acronym. Well, the LPM seems to always be lost, but there is a sense of a buzz according to the internet, and you'll hear it also maybe in some circles when you're sitting there talking about oral biology, is that maybe it's somehow related to TMDs and migraines. And if you ever know anybody that has had migraines, and my late mother-in-law used to have them, well, they take over your world. Those of you that don't, and those of you do, know that. Patients also diagnosed with painful TMDs often report headaches and pain, typically located in the mastication muscles. We know that TMD, as we'll be talking about, is very much, again, has to do with the muscles. And again, that's kind of why we want less invasive things. But we need to know about it. Although it's been suggested again that TMDs can be a trigger for migraine, the role of muscle hyperactivity in migraine has not been clearly established. We know there's discomfort, we know there's spasm with the TMD, but what about the migraine? Well, there's a study, and I'll be posting the link down below here, that again notices that the LPM is hypertrophic. Again, hypertrophic, and we talked about what to be talking about with the master muscle, hypertrophy, so hypertrophic here. And again, in most patients with migraine, and these patients also had signs and symptoms of TMDs. So we have an overlap with the Venn diagram. That's pain, joint noise, and disc displacement when the migraine was present. So maybe there's a tie-in here. Of course, we're not going to jump on the bandwagon because there's a lot of quacks involved in this right now. And a little bit of, things happening there. You go on the internet, it's just full of things like that. And I've seen, enough information that the buzz has to be clearly evidence-based. So the human LPM plays an important role in jaw movement, as we know, and has been implicated in TMDs because it's very tender in patients with TMDs, like I said. Moreover, there's this hypothesis that exists. Abnormal patterns of LPM activity in some patients with TMDs associated with hyperactivity of the superior head of it could lead to degenerative arthritic changes in the TMJ. I'm not sure I would go as far as that, and the study does talk about that at length. So the study was kind of a thing. They wanted to see evaluation of the LPM. Now, they used MRIs and reliable software to, again, calculate the volume. With hypertrophy, remember, we're going to get that volume that we'll talk about in the masseter muscle. Have I got that volume? Again, and the human, in the human, that we can very readily see that, and we'll be talking about celebrity with that. Again, we could talk about the masseter muscle. And then they calculate the volume in the study, and it's really interesting. If you look at it, it's so cool because they go over like a little part of the head and things like that, and they make it into little squares that fit in, and so it's kind of like a Lego version of the LPM, which I just find so fascinating. Just in that side, I was looking at the picture, I was like, whoa, those look like Lego LPMs. And again, they did that, and then they related to the signs and symptoms of TMDs, and it looked very, very good. And then there was the presence of the migraine. Previous studies, again, just did the functional properties of LPM in patients with TMDs based on palpation, which again, palpation in the area here, and electromyographic activity. Again, that's kind of challenging. Think about palpation. Now, the MRI, you got the volume, it's pretty well set. You can do it. This seems very, very, very evidence-based. Another thing that they found, again, seemed that the volume of LPM for predicting the presence or absence of migraine kind of showed a relative importance of each one of the factors on signs and symptoms. Three most important variables related to migraine in patients, again, in patients with migraine, were abnormal abmandibular motion, hypertrophic, again, LPM volume, the presence of the volume with the hypertrophy, and the presence of disc displacement in the TMJ. So which I thought those things. Again, the study found a relationship between all those. The mandibular deviation was related to that disc displacement with a little bit of reduction, whereas mandibular deflection was related to disc displacement without reduction. Now, high percentage of patients with migraine and disc displacement, again, have possible activity that LPM can increase, maybe possibly to stabilize that, again, displaced disc. And that's why we're getting this, again, hypertrophy of the muscles. So again, it's there working extra, and it's, again, trying to stabilize that disc displacement. It kind of makes sense. I will, upon looking at this study, I will send it to my secondary author. Right now she's working on the dental dictionary, so I don't want to overwhelm her. She's in the head and neck activity. I took over so many activities. I was telling Joyce that I couldn't do all my oral biology ones, so I had to let other people be oral biology people this one, because I did that last one on the 3rd edition, somewhere on the 4th. And the second one I did the dental hygiene. So again, this time I'm circling around doing the dental hygiene and emergency and general path and etc. But again, so I will let Dr. Susan Herring know about this study. I think it's a possibility, I think. So in conclusion, again, I want to talk about that this whole, again, theory about stability. Previous studies, again, the TMJ was dissected, showed the superior surface of the upper head of the lateral pterygoid and mid-medial muscle bundles were attached to the disc. So strong findings. That could, again, explains the hypertrophic, again, LPM that's so common in patients with migraine. Again, one of the most prevalent signs is disc displacement. Abnormal disc, again, position could stimulate the LPM activity. Again, attempt to preserve normal function and position. Now, in the study, again, it shows that. But further disc displacement and abnormal mandibular movements, again, need to be studied more. Again, not all patients with TMDs and migraine showed LPM hypertrophy. It was a population. So, that needs to then be studied in the future, and they were very, very open with that. So, the study suggests known difficulties using palpation alone to study the LPM, which made sense to me. It says, again, they used MRI imaging. This may then lead to the further study then. Again, trying to find out, because migraines are horrible, TMDs are horrible, and disc displacement, all those things are such negative things, and be able to use the MRI now. Very, very wonderful. So, signing off then on the LPM, we gave it its just due, and we'll see you on the next webinar and on the rest of the Facebook page. Enjoy. Bye-bye.